Hello everyone, you are watching sqadia.com and I am Hammad. Today, our lecture topic includes certain genetic disorders which have association with skeletal deformities. For example, we will be discussing certain storage disorders such as different types of mucopolysaccharidoses, which constitutes multiple storage disorders. Then we will be briefly discussing the Gaucher's disease, which is another lysosomal disorder in which there is an enzymatic deficiency of an enzyme in lysosomes. Then we will be discussing tumor-like conditions, such as which actually present as mass or protrusion from the bone, but they are not actually the tumors. Rather, they presents like a tumor, which includes multiple hereditary exostosis, or its diagnosis and its treatment. Then we will be briefly discussing dysplasia epiphysealis hemimelica and its management, which is actually epiphyseal exostosis. Then we will be briefly going through such as chondroid tumors, such as enchondromatosis and fibrous dysplasia. They are actually considered benign tumors, but they are not exactly tumors. They are tumor-like conditions. Then in the last section, we're going through the connective tissue disorders, especially collagen deficiency disorders such as Ehlers-Danlos syndrome. Then we'll be going through familial disorders such as Larsen and Marfan syndrome. Thank you very much. Keep watching sqadia.com.